Welcome to M1 and to this really important topic, which is a topic you all in this room might know something about. What is it like to go into a healthcare setting when you have a disability or health condition or neurodivergence? My name's Breandan Ward. I'm really glad to be moderating this panel where we'll look at this question of professionals with disabilities in healthcare settings. And I'll introduce the panel with me in a moment. I wanted to mention what is the question that we'll be looking at and discussing as a panel today. Many of us have an experience of medicine that is really lovely. Who feels passionate about medicine? For many of us, it is the locale where we have had our diagnosis. In my case, at Moorfields Eye Hospital in London, that's the place I went and was told in 2004, Breandan, you have an inherited, progressive sight loss condition. That's the place where I got the answer that I sought. But when I was at the hospital, and at many hospitals since then, I'm not sure how many people, medical people, were there who had themselves a disability. And for those of us in the room who have had a challenge in the medical setting, maybe it's the place where we've got bad news. Of course, any diagnosis can be a helpful information, a helpful clarification, a sense-making experience. It can be very frightening, very traumatic, very difficult. So when we think about the topic of healthcare, it can be at the same time exciting, enthusiastic, hopeful, also a place of challenge, of sadness, of loss. And so what today as a panel we together want to explore is, why is it important to have professionals with disabilities employed in the healthcare setting? What difference does that make, not just to the people who are employed, but also to the care that they offer? How does inclusive employment in healthcare settings make for more equitable health outcomes? How does it change the patient experience? Not just for people with disabilities, neurodivergence, health conditions, but for all patients. And so today we have a very special panel which will start to look at something that you might have heard. Who knows about the medical model of disability? Have you heard of the medical model of disability?
Yes,
That's not the only model. Who's heard of the social model of disability? And you know, in the work I do, I teach at New York University and other universities on this topic of disability. How do we get it into the mainstream curriculum? In the teaching, in the classroom, also in coaching work, this question of the models comes up a lot. I am flawed. My body is broken. I have an impairment. These are all the negative messages that come to us through the medical model. And yet, it's also the model that gives me the diagnosis, the treatment, the potential cure. The social model is often separate. We think of it separately. We think of barriers in the environment. We think about other topics, education, all of the things we're discussing at Zero Project. Imagine if we took the best of both models. Imagine a world where the medical model and the social model are living dynamically side by side, where we take the best of the medical model, that diagnosis that we need to know, the treatment that we need to invest in, the hope of healing, of eyes being fixed. I do hope for that one day. We need to believe in the medical model and sit it alongside the social model. We need hospitals that are accessible. We need healthcare professionals who really understand that Breandan is not just eyes on legs. He is a person with dreams and hopes and desires. And so today's panel is really important because we're bringing together these different models of disability. We're looking at the medical model. Everyone here has vast experience in healthcare, But what's different about my colleagues on stage, each one has looked at this question of how do we bring the social model and the medical model together. One model on its own is not enough. There is no model that's bad. There's no model that's good. Each of the models bring us fruits and gifts, and if we can combine them, if we can lead in this hybrid approach to disability, then better outcomes for patients, better experience in healthcare settings, and more inclusive world in general. So to wrap up my comments, I love to think of this as the 3 Bs. When students ask in class, you know, what is disability? What is disability? I think of the 3 Bs. We have different bodies and minds, all of us. Some of those differences happen to have a diagnosis, some don't. But we each have different bodies and minds that interact with an environment that is full of barriers. That's the 2nd B. Barriers all around. And that's why we're here, to address those barriers. And guess what? Each of us here on stage, there's the rest of us, who we are, the rest of our background, our intersectionality. So it's just a frame that I hope we can take from this session today. Of course, disability is an identity. I don't want to take that away from anyone, including myself, but it can be helpful to think of disability as the experience of interaction, a dynamic interaction between our bodies and minds that are different, barriers in the environment, and our background, which is so rich and beautifully diverse. So let's think in these next minutes together how we show up to disability in a more inclusive way. And on my left, I have Professor Johannes Fellinger, who is joining us from Linz in Austria. Professor Fellinger is head of the Research Institute for Developmental Medicine. And on the left of Professor Fellinger, my partial sight tells me it's Kamil, Zięba, an awardee from Poland, from the Avalon Foundation for this year. So Kamil will be sharing more about the accessibility map that's an awardee this year. And on my right, Shalom Michal, I have Michal Menashe Printz from Asuta Hospital in Israel, who will be sharing more about the patient experience and the crucial innovations happening at Asuta. And at the end, we have Martin Gebetsberger, also from Linz in Austria, not from the university, but from the hospital, who will be sharing as team leader about jobs.com. Please welcome all the panel. I have been told by Margaret that 7 minutes per person is the maximum, so please, we will try our best. Professor Fellinger, we would love to hear more of your work at the medical university and how it's important to bring accessibility and inclusion into a medical university as a means of encouraging more inclusive employment.
Thank you very much for your great introduction with the idea of merging all the models. And the closer the relationship with the real patient is, the less models play a role, and the you is actually significantly relevant. I will give a short overview about inclusive medicine and then highlight medical education and the association between university development and practical aspects. The next slide, please. Or do I have a chance myself?
We need the clicker.
I'll do it.
Ah, clicker. Yeah. Here. Yes, it is the starting point.
All right.
When my father was deaf, and when I came, I'm a trained neurologist, psychiatrist, and child neurologist, I saw in psychiatry how badly deaf people were treated and how many doctors had no idea how to approach a deaf person. And the statement of so many medical experts in our ties still stay, We can't take a history of that person. That person can't speak. But that is highly discriminative, because without a case history, your medical approach is very bad, actually. So this was the starting point to set up special services for people who are deaf. And that is what I found in many of my research work. The health burden people are carrying when they are deaf or have other disabilities is much bigger, as a bigger rucksack compared to population burdens in general. But in general, in our societies, the public healthcare system is functioning to some extent quite well. But for those with big rucksacks have great difficulties to enter the small gate they have. And a few statements about inclusive medicine in general. Of course, we are fighting that barrier-free access to all health services should be achieved everywhere. But in reality, this is not so easy, especially when conditions are complex. So we also are completely aware that by specialization, we can really address the health needs of people with special needs, deafness, multiple disabilities, and whatsoever. So we, in our hospital of St. John of God, we have done the practical example of healthcare centers for deaf people, but also for people with multiple disabilities, and trying to have healthcare more broadly. And the third element of inclusive medicine is that peers, people with disabilities themselves, are part of the healthcare teams. Not only consultants, but really part of the team, because their expertise is crucial to meet the real needs of those who are affected. And that is what we're doing now. We have special harbors for people with special groups and needs, but all together in a general hospital where the mainstream is coming in, but this special gate is welcoming people with special needs. And our key is, we call this outpatient clinic IEM, which is the English term for aim. And we have one big wish and one big statement: to get the goal by asking the patient, what do you want? This is what I train my staff all the time, to be very sensitive. What is the real wish of that specific person? That is the introduction. And now how to spread it. We run the practical examples in our hospital of St. John of God, which has also multiplied in many other places, but I'm also very much involved in medical education. I'm professor at the University in Linz, and it was possible for the newcomers in medicine to have a special lecture, which I called the most important teachers for good doctors. And I invited 4 people with disabilities and paid them as lecturers, and they shared what is important for them. And the audience, the young students, in the first 2 days were very attentive, and they came down and said, I now am losing to be frightened to see those people. And some was asking, why are you so bold, asking the people with disabilities? And they got so much in from them. So we actually are very much convinced that people with disabilities themselves are great lecturers for those who have to serve them. And in Linz, we also have a special trainings program. Martin will speak more about it, to train deaf people with different backgrounds to become experts in serving other deaf people, especially those with multiple disabilities, in nursing and caring, because it's our goal to have about 20% of our staff being deaf themselves in the deaf field, for instance. So at the end, it's where I began. It's about the real relationship with the patient, beyond all the models, but being close to them also means to have people on the board of the healthcare team, which is really very empathic with their need and also shapes the attitude of the other doctors and field co-workers. That's in brief. I hope I kept my time.
Thank you very much, Professor. Round of applause, please. as we start to see some examples of, let's call them the bright spots of practice, how to bring people with disabilities into this healthcare setting, not only as patients. And following from that, I wanted to turn to Martin Gebetsberger, also from Linz in Austria, to share a case study of how platforms like jobs.com can help with more inclusive employment. Martin, over to you.
Okay. Okay, hi everybody. I'm really glad to be part of the Zero Conference 2025 in Vienna. It's really a great honor. I would like to introduce myself in the beginning. My name is Martin Gebetsberger. I'm born deaf in a hearing family. I went to school. And then I started a special kind of education. It was a 3-year training program. What kind of program was it about? It was to become a deaf professional to work in the social field with a legal certificate, and then I started working in the social field. But now let's start. In the beginning, I want to introduce you the Healthcare Center for the Deaf. Here we are offering direct access to signing professionals in the social, general, and physical health for deaf people and hard of hearing. Our team, the entire team, doctors, psychologists, nurses, social workers, interpreters, administrative personnel, and 25 of the staff members are deaf by themselves. They are all aware of sign language and the cultural needs of deaf people. And as well, we are offering longer consultation times for our patients, for our clients. So now I would like to talk about my work, about JobCom. It's an educational training program for deaf adults in sign language. We are doing this now from 19 years, and I am the head of this project. What is important to know about? We have a targeted educational training program which promotes occupational integration through individual guidance. And as well, for us, it's so important to give these really individual and targeted educational training programs. What's so interesting on this picture now, that we have so many different nationalities, deaf pupils from so many different countries, so many different sign languages, and I really love that fact. That's so nice and so beautiful. Now I would like to talk about the special case. We have this young man from Iran. He arrived in Austria. And in the beginning, he had no German language competencies, no Austrian signing skills. And in addition, he had to navigate in this new social and cultural environment. And for deaf refugees, we have this double challenge. You have to learn a new language to interact with the hearing society, but as well you have to learn a new sign language to interact with the deaf community. Through our educational training program through Jobcom, for him it was possible to learn Austrian Sign Language and basic German skills. And as well, there was a lot of peer support. And you know that we have this special kind of interaction, this special empathy. And we have deaf professionals. And these deaf professionals are so important because they are we are having this same kind of thinking. And also this kind of the special visual learning program by pictures and by sign language. In the beginning, we started to communicate in international sign language and then transitioned into Austrian Sign Language. So he was able to as well start in the social field, in the healthcare center. For him it got possible to make the same educational program as I did. So after 5 years of intense training, for him it was not only possible to find a job, and with this kind of peer support and deaf professionals, he got the possibility to learn in an inclusive and barrier-free environment. So this was why, for him, it got possible to find a job, but also to get to this occupational pathway, find the right job. Thanks for your attention.
Thank you, Martin, very much. And such a brilliant example there with some of the people from different countries. It just goes to show us that the world of accessibility does not have a them and an us. And an accessible world has no them and us. There is just us. There is just us. And a beautiful example that we're following up with now comes from a Sutta hospital in Israel. Michal is here and is going to share with us how the patient experience changes when we move beyond just thinking of Breandan as eyes on legs. I'm a patient with a heart and with a desire for access to a facility like a Sutta. It would be lovely to hear, Michal, your journey and how your hospital is helping make inclusive employment in healthcare a reality.
Thank you, Breandan. Good morning. My name is...
Microphone.
Hear me?
Yes, we can.
Okay, so good morning. My name is Michal Menashe Printz, and I'm VP of Patient Experience and Service at the Sutta Medical Centers, which is one of the largest chain of medical centers in Israel. I'm really excited to be here and present this important subject. Where is my... Okay. As a health care organization that cares about people, naturally we have a vision which says that a Sutta shall promote the health and quality of life in Israel by providing quality medical care and health experience, placing the person, his dignity, needs, and freedom of choice at the top of its priority. Based on something that's not good with Based on our vision, accessibility in our organization is an absolute must. When we started to handle accessibility in our hospitals, we first had to learn that accessibility means much more than dealing with physical obstacles. We also learned that we had to identify the entire chain of patients, hospital interfaces, with reference to the patient's entire journey before, during, and after the visit in the hospital. The following are the 4 main domains we dealt with in the framework of a SUTA: physical accessibility, accessibility in service, accessibility in workplace, team education and training. Concerning physical accessibility, we have ensured maximum possible accessibility of hospital buildings, corridors, test rooms, beds, and other medical equipment. ASUTA's Customer Relationship Center plays a key role in ensuring consistency in accessibility throughout the entire patient journey. Various ways of contact. The call center has been made accessible through multi-channels, enabling contact by sending written messages, using the telephone, connecting to the website by email, as well as through text messages according to the patient's specific needs. Any person declaring or claiming to have disabilities is asked by the service representative, what adjustment are we required to make during your visit to our medical centers? We get various requests, such as accompanying a blind patient, enabling sign language interpreter service, etc. With this attitude, we are able to respond to each and every request. The contact center communicates to the relevant hospital department the disabled patient appointment. The organization person in charge of accessibility is also kept up to date, helps and supports the team in creating the right environment on examination day. At the SUTA, any type of information, general or personal, is available in different accessible formats, adapted to the patient's individual and specific needs. So, a partially or fully blind patient can access general or personal information in a larger format or braille font or voice file. Likewise, patients with cognitive disability will be able to access information in a simplified format. As part of our policy to make information accessible to everyone, we provide sign languages service. Service animal policy is a good example of one of our challenges. When we started forming our policy, we knew that service animals were permitted in most places in Israel. The problem was that there were no official government policies, regulation, nor standards on this issue applying to hospital and medical centers. We studied the policy in the US, adopting this as a guiding lines model in our medical centers. Based on the information we gathered, we formed our own policy which permits service animals into most hospital facilities, and we even have a co-worker named Toby, a service dog who is now one of the staff members of our biggest hospital. Every ASUTA staff member participates in a 4-hour training session given by guides with disabilities from Access Israel organization. Nearly 3,000 ASUTA employees have already participated in this educational program in the framework of ASUTA Medical Center School of Professionalism. Every service providing staff member has to take this course once a year. Accessibility means accountability and responsibility, leaving nothing to chance. Therefore, we integrate accessibility in our policy and standards, develop our own education and training programs, adopt accessibility as an integral part of our regular control system, ensure accessibility budget is an integral part of our annual budget, and learn and draw lessons for complaints. I would like to thank you for the opportunity to speak on this important subject. And let's not forget that people might not remember what you said. They might not remember what you did, but they always remember how you made them feel. Thank you very much.
Thank you, Michal. Thank you very much, Michal. It's a lovely reminder of what happens when you bring the best of the medical and social model together. What happens? There's no more them and us. There's just us. There's just us. And it's a lovely segue now to our last of the presentations before we open the floor. And we're turning to an awardee from Zero Project 2025, Kamil.
Hello. Thank you very much. Hello. Warm greetings from Poland. A few words about us. Avalon Foundation is a nationwide non-governmental organization established in 2006. Thanks to the efficient management and ensuring high quality of services provided, we have been at the forefront of Polish non-governmental organization dealing with the issue of disability for years. We support people with disabilities and chronically ill people so that they can be active. We help in raising funds, rehabilitate, promote sports activity, and educate. We believe that a person with a disability can be independent and active in every sphere of their life. Okay, so now about our map. Accessibility Map is an interactive map of accessible services which doubles as a search tool, thanks to which people with disabilities can find a medical facility adapted to their needs, as well as doctors and specialists with experience in admitting patients with disabilities. This is an innovate project in Poland where people with disabilities can search for an appropriate medical office based on very specific, very detailed requirements and the doctors of all specializations. Now you can see the Accessibility Map homepage and some of the filters. Available facilities are marked as points on the map of Poland. We divide the search filters into architectural adjustments, sensory adjustments, ensuring the comfort and privacy and security, staff experience, and the form of registering and visit the receiving the results. The patient can also indicate the need for a personal assistant or check the possibility of extending the visit. We have also more detailed filters. For example, according to the architectural adaptation, these include ability to reach the office using a wheelchair, horizontal marking for the blinds, automatic doors, elevator, toilet for people with disabilities, adjustable gynecological chair, and lift for transferring people with mobility disability. You can check if the facility offers alternative appointment and result collection options and access staff experience with patients with disabilities. This is an example of using the filters to find a facility that is in a 10 kilometers radius of a chosen spot of the map. We inform patients whether they can use the services free of charge through our National Health Fund or whether they have to pay for them themselves. Thanks to advanced geolocation function, you can find a suitable place in your area or by entering a specific address, name of the street or city. On the profile of each facility, you will find detailed contact details and details how to get to the facility. You will find what healthcare professionals you will find there, also the name of the doctors, and the adaptation and accessibility measures, not only written form, but also through symbols. I was deeply moved by the story of a 25-year-old, larger-bodied girl who used a wheelchair and was unable to undergo a gynecological examination due to the lack of suitable clinic in the entire province. The lack of information was also a huge problem. Thanks to our map, the entire package of information is easily accessible and concentrated in one place. At the moment, our website works in Polish and Ukrainian. We are working to making it possible to use it in English. Our map can be implemented and replicated both nationally and internationally, supporting the creation of an inclusive society. We are currently preparing to combine the accessibility map with another initiative run by the Avalon Extreme Department, a map of accessible sport facilities, such as gyms and other places of physical activity adapted to the needs of people with disabilities. Our goal is to create a single comprehensive platform that will cover all accessible places in Poland. In the future, we plan to create databases of adapted cultural institutions, educational institutions, and public entities. Okay, thank you for your attention, and on behalf of the entire Avalon Foundation, we thank you for this wonderful award. Being here opened the doors for us to share our solution with organizations and experts from all over the world and inspire others to create accessible, more accessible places, spaces, and services. Thank you very much.
Thank you very much, Kamil. I'm keeping the earpiece in my ear because I cannot keep an eye on the time because I can't see the time, but I can keep an ear on the time. And that's what the headset is doing for me. We hope in this little tour we've taken together, talk about crossing borders. We had Austria, Israel, Ireland, Poland. There is no them and us when it comes to disability. We can learn from each other, and we can hopefully in this session give you some ideas. So start to think of your questions, or perhaps it's a comment or something you'd like to share with all of us here today, thinking about this question of inclusive employment, specifically in healthcare. We've managed to look at some of the areas. Michal shared with us about the patient experience. Think about businesses. We think about customer experience. Why not have the same lens on experience in a medical setting? We heard from Martin about the power of jobs.com and how it can help be a platform to bring disabled talent into the workforce. We heard from Professor Fellinger about the efforts in Linz on training and staffing and getting more representation and awareness within the hospital setting among those studying medicine at universities. And of course, the accessibility map, which for now is awarded based on the healthcare application, but with future plans to expand in Poland. There is a roving mic. We would love to hear from you. A question or a comment, something that resonated for you, something that you'd like to share with us from your own perspective. So you can raise your hand, and there's someone with a mic who can see better than me, and they will come to you. You'll speak into the microphone, and we will hear you. That's the plan. Any questions or any comments?
Yes, we have someone want to say something? Yes.
So thank you very much. That was a great panel. My name is Charlotte McLean and Chapo from the World Bank. Thank you. And I wanted to thank Kamil particularly for a really exciting presentation on the accessibility maps. And you mentioned that at this stage you focus on Poland and Ukraine, and that I assume it's both in Ukrainian and Polish. We are supporting the design of a project in Tanzania that wants to go in that direction. And so I was wondering if you could tell us a bit more about what your timeline is to making the accessibility maps available in English so that we can look at scaling these and potentially working with you. So if you could talk a bit more about that, that would be great. Thank you.
Okay, about the timeline, it's because we are a non-governmental organization, we need to have funds for this. I think, and we're trying to do this, we want to create it in English to the end of this year. I hope it will be to the end of this year. About the Ukrainian, we have another project in our foundation where we help refugees from Ukrainian.
Thanks, Kamil, and thank you, Charlotte, for the question, because it's a lovely example, and the work at the World Bank that you lead is so crucial to helping identify the bright spots like what the Avalon Foundation are doing and helping signpost ways we might be able to expand that. Who else would like to ask a question or share a comment?
Hello, my name is Katja Österreicher. I'm responsible for digitalization and innovation at Vinzensgruppe, which is the largest hospital group in Austria. It's a platform of religious female order hospitals, so very similar to Professor Fellinger. My question is as well to this project in Poland. Congratulations, I like it very much. We have developed, together with Siemens Healthineers, a digital platform. It's a patient portal to get accessibility for handicapped people through the digital way to our hospitals. Is this planned, something like this, in Poland as well? And are you including digital accessibility in your project as well? Thank you.
Okay, I'm really sorry because I don't English, and my English is not so perfect, so I'm sorry. Okay, maybe Małgorzata could help me.
Just give us a second because I need to translate that into Polish and then we go back to you, okay?
And in the meantime, I might chat with Michal for a second. I wonder, in the example that you give from Asuta, how much the digital experience comes in. Is that part of the project or something in the plans for the future? Just to the same point of the question around digital access.
I told about it. We are the digital is very, very important for people who have disabilities, and I gave an example about our contact center that you can write messages or to send an email, or by the website you can talk with us, whatever you want, with any telephone or digital items.
So there are different ways to access, and the example you gave around using digital, and is that part, I guess, Kamil, for you, thinking to what the accessibility map shows? How is it working on the digital side of things, access to the digital?
Okay, Małgorzata, please help me. It could be easier and faster.
Yes, so Foundation Avalon is all about all kinds of accessibility. So digital accessibility also part of that. If you have a project, you need some kind of a cooperation, or even you want some pointers on what to look at, this is a good person to talk to. However, because Kamil is very self-conscious about his English, I can act as a translator. So I would propose that anyone who wants to tackle the digital accessibility and how we can use the accessibility map, because they are one of the Zero Project Awardees, because I come from Poland as well, will be happy to help to make that connection.
Thank you.
Thank you.
Thanks a lot, Kamil and Margaret. Any other questions or comments from the room? Who has had an experience from your country of a lovely experience in medicine in hospital setting? Would anyone like to share an example? perhaps an aspect we haven't covered here so far about when the medical and social model come together positively, or even an example that you know of.
Hi, my name is Agnes Sarolta Fazekas-Vinkovics. I'm coming from Hungary, and my field is inclusive education, but I wanted to share also education and also this topic. I also have been working with the Council of Europe on human rights education, and what is very important here is that I also have colleagues who are human rights educators, but also one of them is a medical doctor, and her mission is to bring human rights education and medicine together, also making awareness among doctors and medical professionals in hospitals. So basically this is bringing education, awareness, and also how to deal with kindness and care with patients, with all patients and also patients with disabilities. So I wanted to share this connection on human rights education and the medical field. Thank you.
Thank you very much. Are there any examples in the room, and Professor Fellinger was sharing with us the importance of having the training and awareness and education in a medical university. Any examples that you know of that we can hear from as a group together of the social model of disability being talked about, being studied in a medical university, in a medical degree?
Hi, Michal Menashe from Access Israel. First of all, I had the pleasure of seeing firsthand both Johannes's hospital using sign language as a norm, which was amazing. The human factor there, giving an experience for deaf people to really be able to receive medical treatment like everyone else. And to see in Asuta in Israel, we have trained employees in Asuta, and it's important to stress it's not just the medical staff, it's everyone. It's because when you come to a hospital, it's not that the doctors are standing straight and just waiting for you and they're the ones who are going to see you first. You have to go through a whole routine, and you have to make sure that the accessible experience is there from beginning to end. In Israel, we are lucky that the laws there require accessibility training on services for everyone, including the medical field. And I can tell you, as you asked, Breandan, from the beginning, from the universities, if you put the seeds in there and make it, you know, at first when we approached universities or schools for nurses, for example, the first reaction we received were, oh no, we are all the time surrounded by people with disabilities, so we don't need any special training. Well, guess what? The first nurse that took the, sat in a wheelchair and we rushed her to the, Röntgen services, she's like, oh my God, I run even faster. I'm doing such a bad work for the experience of that patient. And I think that that training, that knowledge, that sensitivity is so crucial and really should be from beginning to end.
Thank you, Michal. And we have a few minutes left, and I'm conscious that we've heard from Kamil and from Michal just in response. I wanted to use the last minute or two just to give Martin and also Johannes a chance to share anything that's come up for you, just as you heard the other presentations and the questions. Any final thoughts, Professor, you'd like to share with us?
I think when it comes to really implement a deeper insight into accessibility, you have only two ways. Not a lecture, but teaching by experts by experience and self-experience. We all train, all medical students are deafened for 2 hours, and they have to stand it and get a really challenge in a deaf condition, and then they know much more than they could ever be taught in a lecture. And experts by experience are the other part. The little bit of we can do theoretically is not sustainable. That's in short.
Thank you. Thank you very much, Professor. And Martin, turning to you to give you the last word, anything
What I would like to add is that at the healthcare center in Linz, all of the staff members, when they're arriving, and of course in the beginning they don't know about sign language, or maybe they don't know about our culture, but it's not about giving this short, just 4 hours course of a workshop in the beginning. No, it's an ongoing process, and you really have to get this deep knowledge of the culture, of the language, how to interact with others. That's a really ongoing process. And for people with disabilities, the healthcare sector must be accessible. And we need more information, and this information must be shared.
Thank you, Martin. So we hope in this hour that we spent together, all of you are leaving the room with a few key takeaways. Number one, there is no medical or social model that can exist separately. We need both. And whether we are medical professionals or patients or both, need to always carry both of those things together, because together the medical and social model helps meet us as humans in our diversity, and hopefully makes that experience, as Michal mentioned, something that we remember for the right reasons. And secondly, we hope that you will do what you can in your context to follow this up and to make it a reality, so that healthcare professionals are not excluding, the healthcare profession does not exclude people with disabilities, and that we can make it another example of inclusive employment for all people. Thank you very much.